So one of the things we talk about in the United States often is that we have the best medical system in the world. The only difficulty with that is it doesn't hold up to actual reality.
It's actually a myth that the U.S. has one of the best medical systems in the world. It's a big, big myth. It's widely held, but it's actually pretty easy to knock it down. You just have to go to the World Health Organization, and you can find there that the United States follows 40 other countries in the maternal mortality rate. 40 other countries, including Bulgaria, Slovenia, Croatia, Cuba, Costa Rica, they all do better than we do, and they don't spend anywhere near the amount of money we do. All of those countries use midwives, way more than we do.
The citizens of the United States of America should know, and the women who are of childbearing age should know, that there's been an ongoing slippage. As we've put all of our money and our research into high-risk care, we haven't been paying enough attention to normal birth. We haven't been paying enough attention to reassuring women that birth is normal, that they can go through birth and actually have an experience that is a fulfilling experience.
And so as we get statistics back each year that show that our mortality rates are not improving, rather than saying, let's start over, let's think of a new direction, we say, let's add more technology. And then we have poor outcomes and we say, well, let's add more technology. And so you get the snowball effect where you're spending more and more money and you're getting poorer and poorer outcomes. And so at some point, there needs to be a realization that that direction isn't working for us.
The question then becomes, what's going on? Why aren't we doing better if we have the best system, if we have the most highly trained people doing this? And the result is of, to a degree, other events that are occurring, that there are consequences to interfering with birth.
And it's interesting, the more research we do into what produces health in mothers and babies, the more we understand that intervention or things that we add to the equation sometimes are themselves have impact.
We often refer to this as the cascade of birth. That what happens is if you treat mothers as likely to have a problem, then you're going to start intervening. Those interventions themselves have consequences. And so a mother comes in and they're concerned. And so they bring her in early, and then they induce her because they want to have that baby out sooner. The induction leads to very strong contractions. The mother's having difficulty, so they give her an epidural. That slows down her labor. They then give her more Pitocin, the drug that's used to speed up labor. It becomes increasingly difficult. They've hooked her up to a fetal monitor, which cuts down on her ability to move around. They see some readings on the fetal monitor, which may be accurate or may be what are termed false positives, but then they decide to do a cesarean. And then they do the cesarean and say, thank God we have all of this equipment that could protect you and your baby. The reality is, if they hadn't done the first set of interventions, the subsequent events may not have occurred. And so the rule of thumb should be, let's have birth involving the least intervention possible, which occurs only in response to identified events. If we started from that presumption, we would change the whole ethic of birth in this country.